Black History Month is an incredibly important recognition of the contributions of African Americans to here in our country. And it gives us an opportunity for us to focus on Black history and to acknowledge that there have been incredible members of the community that are Black entrepreneurs, doctors, lawyers. They have served in so many different functions to help develop the economy in our country.
It's an opportunity for us to reflect on the accomplishments of overcoming this country's dark past.
The theme couldn't come at a better time, as health and wellness has been a part of our conversation over the past couple of years. As myself as a healthcare professional, I feel like that my role to my community is to make sure that we all have the accurate knowledge and tools that we need to make accurate decisions about our healthcare within our family and our colleagues and friends.
Black health and wellness is important to me, not only because I am an African American female, but because I know that the research shows that women lead the households when it comes to healthcare. And so it's important for me to make sure that healthcare is supported throughout all households.
Health and welfare is really, really important to me, particularly maternal health. If mothers are not healthy, then their children are not healthy and their family's not healthy. I was very proud of Senator Skinner for championing a bill that her and I had been talking about for a period of time. I believe it was SB 65, which provided an opportunity for us to focus on improving maternal health, and in particular maternal health pregnant women and their babies. The incidence of death of young Black children is just startling, and it is absolutely unacceptable in a country as advanced as ours. And so that bill provides us an opportunity to really go out to the community, understand what's happening, and to focus dollar resources on reducing infant mortality rates and helping mothers to care for their children and to be prepared to be mothers.
Black health and wellness means directly mitigating the issues that are impacting Black families in our community. It's addressing the issues that Black women are facing every day with the disproportionate impact of African American infant mortality with preterm birth. It's ensuring that we have high quality designed neighborhoods that have access to parks, healthcare, good paying jobs, and a healthy, thriving economy.
The pandemic has hit us rather hard. We as Blacks, because we have a historic distrust or mistrust of the healthcare system, it's been a little bit harder on us because we don't typically want to go to the doctors. We don't typically want to participate in the healthcare system.
COVID-19, we've pulled back the curtain on a number of issues that have disproportionately impacted the Black community with high mortality rates, with mitigating the issues of ensuring that vaccines get into the communities that need them most, with the infection rates of COVID-19 plaguing Black families and destroying the Black home.
The social determinants of health need to be addressed, and it's great that we shine a light on it in the month of February, but it's equally more important that we look at healthcare every month to make sure that everyone has what the Institute of Medicine describes as safe, equitable, effective, efficient, patient-centered care.
My mother was a registered nurse, and she served a really important function in our family, provided the opportunity for phone calls at midnight from family members and friends who were distressed because someone in the family was ill. There's nothing worse than not knowing what to do when your baby or your child or family member becomes sick, and do you take them to the emergency room? Is there something you can do to take care of them right away? And what I learned from that is that having culturally appropriate, language appropriate medical health professionals that can answer your questions and provide support for decisions about what you need to do to take care of your family is critically important.
We're having a nursing shortage, and what that means for me is that as Black, Indigenous people of color continue to need to access healthcare, we won't have culturally competent individuals in order to deliver that care. So for me, I want to support nursing to make sure that we are getting those individuals into nursing schools and out in the communities in which they serve, because once that happens, then we can work on the social determinants of health.
My inspiration was another nurse, someone who actually looked like me, who saw something in me that I did not see in myself. What that person told me was they felt like I was a smart person and that I could do so much better than what I was doing. As an instructor now, or as an educator now, I do everything I can to reach back and help other people.
As a director of nursing, I feel that it is my duty to make sure that I'm part of putting out nurses into our community.
Nurses have a warm and fuzzy place in my heart, not only because my mother was a nurse, but also my sister. And nurses hold a really important, or have a really important role in the provision of healthcare. When I go in to see my doctor, I spend 5 minutes with my doctor, but I spend half an hour speaking with the staff that most of whom are nurses, that ask me questions, have a conversation about my health. And so I really believe that the opportunity for members of the public to have conversations with health professionals is critically important. So I thank them from the bottom of my heart for all that they do.